So in this part we're going to look at rheumatoid arthritis for exercise referral, and just a brief overview of the condition to help us get through the qualification in terms of understanding a bit more about it. So again, we've got our healthy area here, our healthy synovial joint, and what happens with rheumatoid arthritis with this joint? Well, rheumatoid arthritis is an autoimmune disorder. So the actual body attacks itself. So the body mistakenly attacks itself. What happens now? I've highlighted here this synovial membrane area, and I'm going to say that's the bit we've got here. Well, the body would produce white blood cells. So we've got these white blood cells here. What these blood cells will do is produce something called cytokines. And we'll actually write that up so you can see it. And hopefully you can see it with this pen. In fact, I'm going to change the pen so you can see it properly. I'll make sure I get the spelling right of this. Now these cytokines, what they do, they actually interact with this cell membrane, and then other substances, very, very harmful substances are produced, and they're very, very destructive to this area here, the synovial joint. What happens? Well, with the synovial joint here and the synovial membrane, new blood vessels grow. So in this area, this causes new blood vessels to actually grow because we've got a lot of damage going on, and it causes this area to thicken, causes the wall to thicken, and we call this a pannus. So this is starting to thicken up, this pannus, and it's invading the space here. So it's actually restricting the amount of, limiting the amount of space in the synovial joint, and it starts to destroy the articulate cartilage as it gets further on and further on and further on until we've got very little to no space here, and we've got the articulate cartilage is destroyed. What can happen when this is destroyed? Well, the bones can actually start coming together, which is not a good thing. We call that ankylosis. And with ankylosis, you will find that the bones fuse, which causes the bones to become very immobile, and there is a problem there with movement. The problem here as well is when these bones do fuse and join together, there is no cure to it. So it is a degenerative condition. Signs and symptoms of this, well, generally it's going to affect the wrists, the hands, the knees, it affects ankles and it affects feet, but it affects on both sides of the body, where with osteoarthritis it can be localised areas. With rheumatoid arthritis, it can affect, when the person gets a flare-up, it can affect both sides of the body. So it can affect both knees, and it will affect all joints in the person's body. That's why it's very important when somebody gets a flare-up, they do not exercise, they're deferred. And that would be an important thing to ask your client who's got rheumatoid arthritis before they start a session. Are you experiencing a flare-up? Because if they have a flare-up, they can be deferred to another session, or when that flare-up, should I say, is over. That's a very important thing. The actual signs and symptoms of it are going to be pain, going to be swelling, going to be inflammation, difficulty in movement. There can be deformity in the joints, deformity you can see in the bones, you can see the skin is affected as well, because with rheumatoid arthritis it doesn't just affect the synovial joints, it affects the eyes, it affects the skin, the heart, the lungs, the kidneys, the central nervous system, so it affects the whole body. And that is rheumatoid arthritis.